that yes, have been adopted by societies like the American Psychiatric Association, but this is again in the absence of longitudinal data, which really is what should drive practice. It has nothing to do with how we feel about it as individuals and everything to do with what our outcomes are. So for instance, they actually they state that children as young as about 9 years old, Tanner stage 2, when breasts start to develop, when genitals start to enlarge for young boys, they state that GnRH analogs, which we think of as puberty blockers, they're actually medications that are used off-label. Traditionally, they're used to treat prostate cancer, but as early as Tanner stage 2 or about approximately 9 years old, we're recommending use. And again, in the absence of longitudinal data, there may be short-term studies out there, but we do not have, I think there are only 2 studies that go beyond 10 years to my knowledge. But I just wanted to come up as a concerned physician who actually practices within academic medicine.
So Aaron, I'll bring you into this real quick. Some of the data points that I think are worth discussing here is okay, this is according to a study from UCLA School of Law. 1.6 million people in the U.S. identify as trans. 0.5% of all U.S. adults, that's 1.3 million. But it's worth noting that 1.4%, which is 300,000 children between the ages of 13 and 17 now identify as trans. That means 20% of the trans population are children,
I'd love to jump
which
in on
is
here.
through. Who was that?
Yeah,
Oh,
no, this
Aaron.
is me.
Yeah,
This
yeah,
is
yeah.
me. I would
Yep.
love to talk about this.
Yep.
And in fact,
And 5 years
would
ago,
like,
that number is half of what it is today.
you,
So
you know, you, this is such a good thing to talk about because look, we started this conversation talking about suicide rates, and even the previous doctor just now spoke about the high suicide rates. I want everybody to go into Google Images and type in survivorship bias. Look at the picture that comes up. You're going to see an airplane with lots of dots on it. That's because back in World War II, they were sending airplanes over Germany, and the ones that came back, they noticed where the bullets were hitting. The places where the bullets were hitting, they decided that was where we needed to put the armor. In reality, those are the planes that were coming back. Those were the planes that survived. The armor needed to be on the other places. You're seeing that with this as well, because these high suicide rates have managed to manifest over this long period of time. You see older populations with very few transgender people, and you wonder why. It's not because there's some massive influx of trans people that are just being groomed or being contagioned. It's because right now, young people feel the freest they have ever felt to express their identities, and old people have had to live for a very long time through very repressive times for transgender people, resulting in the actualization of those high suicide rates that we have been talking about for a very long time now in this very discussion. And I think that that is a very good reason why you might see such a big difference.
okay, so I have to be honest here. There are a lot of questions, especially in the comment section, and I will encourage everybody to go down there, hit the right hand corner, and leave us a question for our panelists. We're always digging through there. But is there a possibility that that high suicide rate is due to an underlying mental disorder? Due to, I mean, gender dysphoria is classified as a mental disorder. Is that what is driving the high, at least attempted suicide rate,
Yeah, so
or
I
is
mean,
it?
yeah, so I mean, like this is something that has had a lot of study behind it. We've heard discussion about the limited nature of the studies, but there are dozens and dozens and dozens of studies out there, and what we can see is that whenever you do allow somebody to transition, even up to 5 years later, their suicide rates are still very low, their depression rates are very low, their major depression is very low. There are so many studies that are out there that are being used, and yes, we have not had a double blind randomized controlled trial study on hormone therapy. That would be impossible because of the fact that if you were to be given testosterone and saw your hair growing, you wouldn't be double blinded. It's impossible to do these kinds of studies, just like it's impossible to do a randomized controlled trial on jumping with parachutes. And yet we still give parachutes to people because there is very good evidence that parachutes will save your life. Just like gender affirming care for transgender people. Yes, gender dysphoria is a mental disorder. Being trans is not the mental disorder. And I would actually like to go back to something that Sebastian had said earlier about how we don't affirm mental disorders. We are not affirming the dysphoria. We are treating the dysphoria. being trans is not the disorder, the dysphoria is. And transition is scientifically recognized by all of these medical organizations as the best treatment. And I will close with one more point. If you out there disagree with this and you don't think that this is the best treatment for you or for your kid, that's fine. But in America, at least, we value the patient-doctor relationship and the freedom to make that decision and to make these medical decisions as long as they go with best practices for yourself.
Yeah,
and we have 22 bands out there that are attempting to end that.
So we'll quickly, so you try to unmute Marcus, and then I got to go to